person of the panel, I would like to draw your attention on coping mechanism of the student with disability to online education in public university in Sri Lanka. Actually, this is collaborative project and my co-workers also are here with us. And these are the contents of the study. And when we discuss about the higher education is a difficult task for students uh, with disabilities in a time when the entire education system is going through the drastic transition uh, due to prevailing pandemic situation. It's extremely sorry. Extremely sorry. This is we are talking about the challenges related to the online education. One of the challenges I have faced. Extremely sorry. Um, when we draw our attention to higher education, it's difficult task for students with disability. COVID-19 has big impact on students who attempt to attain education goal while dealing with the variety of crises in inclusive education, adjusting to new normal circumstances. In the time when the entire education system is going through the drastic transition due to the prevailing pandemic situation of marginalized is not hidden. Due to the pandemic, students with disability have been required to accept and follow online education since March 2002. The COVID-19 has this student has no any other option. With the basic understanding of this, actually we got chance to attend one of webinars organized same organization institution from University of Colombo and University of California attached to the Center for Disability convention during lockdown is a webinar series organized by you, and we got chance to refer these reading materials also. And then when we read these materials, actually findings you have found, we thought that we should look at more in-depth. We have to do in-depth research related to the inclusive education and online education. This kind of mix studies, and also we want to looking at the unique experience of these students face in their day-to-day life. Based on that research problem of this study intend to identify coping mechanism in the face of online education and their own experience with their coping mechanism for minimizing the negative effect of online education. And then when it comes to theoretical framework, theories related to the inclusive education can be used as right-based approach to this study, and unique experiences related to the gender. We thought that we can do a comparison study and related to the ethnicity also, and also we concerned about the traditional education system and online education system, because education paradigm shift we have to concern. We use a conceptual map to understand the situation, and then based on these pins, actually this study attempt to cover three main points to identify their coping mechanism to minimize the negative effect of online education on visually impaired students, to understand the individual groups and collective strategies used to adapt to this education system in online system, and also finally we come up with the social work intervention for negative effect of the online education. And nature of the study was qualitative. Of the sample method was used as a sampling method. A sample of 20 students was selected and data was collected using telephonic interview, and also we use interview guideline as a research tool. Additionally, we did in-depth interviews, and three case studies were selected to explore the basic reality of online teaching and learning. When it comes to the sampling, we concerned about the undergraduate of the public university, and we identify with visually impaired. Then we did a kind of comparison, traditional education and online education, and data was analyzed qualitatively. This research is an ongoing research. At present, we are only able to complete the data collection visually impaired female and male students studying in 3 faculty of University of Colombo. In the current situation, data was gathered through the telephonic interviews and ethics was followed to get the relevant information. Right? When it comes to the limitation of the study, we could do only visually impaired student. Due to that, information of the physical and speech impairment could not be obtained. The service provided to students with disability at other university and experience are not covered in the study of online education. The finding of the study, according to the sample, out of the total 20 students, 5 males and 15 female participated. That areas where students live include Colombo, Gampaha, Kurunegala, Badulla, Vaunia and Kilinochchi. Only visually impaired students were able to participate in this study. There were 10 fully blind and 10 partially blind. The ethnic diversity of this study sample was about 17 Sinhalese and 3 Tamil students. Among the faculty represented by students are arts, education, and law. The academic student is from the 1st year to the 4th year. And then when they discuss about the cost of their online education, 19 students of sample were told that the cost of online education was at least 1,500, around 2,000, and only one student said about sometimes assignment and exam. Based on the assignment and exam, she can't tell accurate amount. And some students are already receiving financial assistance from the university and other institutions. Then when it comes to the facilities given by the university, bail and accessibility, and also some students they talk about that still they have kind of issues related to library facilities, and most of the students they talk about the support we receive from the academic staff is excellent, very good, and very good comment regarding the lecturers. And service provided by the Center for Disability and University, they also have high appreciate of the service delivery of University Disability Center. And one of the first year students, she said about yes, we had the orientation program, which was about how the technology should be used, about how to send email and LMS as well. Having such orientation program can be very useful for them, because she comes from a rural area. It is she said about it is kind of exposure to technology. At the beginning of the study research, it was noted that many of demand of the student in the discussion on the webinar have been met, and analyze this can also be seen as a confirmation of the right approach in the inclusive education. According to the student, the university is currently developing accessibility guidelines for LMS. The experience of findings also confirm the students have difficulty adapting the first wave of the COVID-19, but they are now familiarized to it. And these students use technology more than ever. The online method was introduced as a method that could be used by anyone. They felt that they were being taught more than ever to teach theoretical facts during physical education. Sometimes they go to the lecture hall late because of problem with their ability to access the lecture hall. They said that the problem would be solved under this online education system. They were concerned about the lack of practical training regarding online education. Students who were fully blind said that greatest challenge they encountered with the online education system was the technical side of online education. Uh, uh, One of the students, he shared his experience of sometimes they have to face accidentally switch on the mic during the lecture, and the session was disturbed by the sound from his house, and then the lecturer uttered his name and asked him to switch off the mic, but they said that it took a long time to mute the mic for them. They said that at that point they felt somewhat shy about their self. In comparative analysis, the experience of visually impaired student may be different from that fully visually impaired student in this study. Because they said about that they are difficult to whole day, that sometimes they had to stay whole day phone and or tab. When they saw it with one eye, it is very difficult to cooperate with the situation, and sometimes they feel like mentally stressed. Quality of the education, the majority of respondents say that although this method is good for continuing education due to the pandemic, they prefer education in a physical environment. Uniqueness of the study, actual unique experiences related to online education. According to the finding of this study, the unique experience faced by visually impaired students in adapting to online education cannot be excluded out or avoided. Understanding their own experience of them, the mechanism by which they deal with the education issues provide a better foundation for the well-being as well as the protection of the right of these students. Then actually this case is she goes for the mountain to listen lecture. While on the mountain, heavy rain and wind come. While I was listening to the lecture on a rock, it suddenly rained. Strong winds were found. My umbrella was too small to protect me from rain and wind. I was soaking wet and I got a cold. Usually I have an allergy to cold. It increased. I have had many experiences like this. There are so many experiences like this that I can remember in the future. And also the another student, she said about that environment of in the family, and there was she belongs to extended family. There are 9 members in her family, and her father is the only income earner of the family. She used to share her room with her 2 little brother, and her environment is not supportive for her education. She find difficulty, and she started once I was in an English lecture, and the teacher asked me to answer for a question, but if I open my mic, all the noise will hear to class, so I did not open the mic and keep the silence. I feel guilty and shame, but I have uh, I have no option. And when it comes to these unique experiences, actually, and most of them feel kind of stress, and sometimes they feel headache, especially partially by any student. They said about that this psychologically impact because they can't, because some students say about they have health issues, and then when it comes to the survivors of the education, some case study have shown that the motivation to win this higher education is struggle continue process, but the strategy they use will lead the building of the own personality as an independent person. It can also be said that some of the potential students be, and this is that very extraordinary case. Actually, he used that kind of cooperative approach to the overcome his difficulties with the mingle with the student, mingle with the teachers and friends, and also using his soft skill and technological skill. When it comes that conclusion of the study, that it is important to note that multiple factors play a role in overcoming the challenges faced by visually impaired students in the mechanism of coping with the current situation. And blindness is not a barrier to online education. Only thing that system should be that comfortable and reality aspect to derive from disease exploitation, construct a better environment for students with disability to engage in social work intervention in the limitation of inclusive education. And these are the suggestions. They suggest blended learning, and also the creating awareness among the students, also the lecturers, and appoint sensitive coordinators on disability, training for trainers, and enhance the skills of IT among visually impaired students, also soft skills. And some students, they say about their financial issues, and still they didn't couldn't get tab from university. And then these are the soft skills, social work intervention of the study. And I should acknowledge my co-author, Shari Gunaratna and Abhishek Thakur, also data collection team. Thank you for the opportunity. Sorry for the interruption.
Thank you, Chandima. We will take questions at the end. Now we have Isuru Ratnayaka presenting. Isuru, are you here?
Doctor, can you hear me?
Okay. Isuru is from the Department of English, University of Kelaniya, and he too will share with us about access and education. Isuru, you can start, and you should be able to share the screen if you want.
Yeah, thank you. A very good afternoon to you all. I'm Isuru Ratnayaka from the Department of English of the University of Kelaniya, and thank you for the opportunity given to me to present my study on the empowering of first-year undergraduates with disabilities in state universities during COVID-19 pandemic. So let me share my screen first. Hope you can see the screen. Yeah, so thank you. Now, so this research emerges in the research context of like, so during this year, I have been engaged with one of my colleagues from the department, Ms. Sabrina Niles, in a series of research studies where we investigated or tried to investigate the impact of COVID-19 upon the education of students with disabilities at the university. So this research is an attempt to investigate one of the areas that we show as in need of intervention in terms of improving the quality of the education for the students with disabilities. So in that regard, so this the objective of the objectives of this study are to like understand the impact of the challenges, particularly the students with disabilities may face in terms of integrating themselves to the university education or transitioning themselves from the secondary education to tertiary education, and the impact the COVID-19 pandemic may have had upon that integration. And to, at the end of the study, to identify or to try to find out or to investigate the possibility of looking at the pandemic as a way of renegotiating disability, our pedagogical practices, and to make an attempt to interpret the pandemic through a disability perspective as a way of understanding or exposing the cracks in our pedagogical responses. So within that, with that understanding or objective, this study tries to highlight three key areas, one of which is the impact of segregated learning. So now the study has been conducted with 8 students, and the mode of interviewing had been narrative interviews to understand their experiences. And the students have been selected with references, with the intention of having a range of disabilities being represented, as well as a range of universities with different geographical locations, University of Colombo, Japura, Kelaniya, and Jaffna. And within that study, one of the key areas that we discovered is the fact that the most of the students who are coming to the university are coming from segregated learning environments. And there's an impact that these segregated learning environments are making upon them in terms of integrating to an inclusive classroom. So within that reality, so one of the things that I have noticed with the interviews was that they tend to congregate themselves or to remain themselves within a certain group of students, which then led to the question of whether this is the group consciousness or fear of exclusion or rejection from the others. So one of the key observations that I made was that one of the students from the University of Jaffna highlighted that they have their own drama competitions, they have their own extracurricular activities, which meant that they stay together as a group, or they do not try to mingle with the students who are not having any disability. And another experience that I gained through teaching some of the students with disabilities. Last year, I had the opportunity of teaching the visually impaired students at the University of Kelaniya. They are compulsory first year English subjects provided by the Department of English Language Teaching. So one of the key observations that I made during that experience was that there was one student who was well beyond the ability of the other students. She had been coming from an English medium education, and having done literature, she had some higher capacity in terms of handling language. But she refused to leave the class. They had a special class for visually impaired students, and she refused to leave the class, even though I highlighted the benefit that she can gain by learning within a similar group of learners who have similar capacities or similar learning capabilities. So this shows that integration or internalization rather of the discourse of like fear that this is difficult to mingle with other people or people who don't have a certain disability. So now this situation has been aggravated within the COVID-19 pandemic. An observation that was made during the interviews, because one of the students, so the names that are used here are fictitious. Their names are created, but in terms of like personalizing the experiences, the names are used. So one of the students highlighted the fact that she doesn't have to worry about the other batchmates or their questions or what they would or might think about her if when she is to join through online means of learning. And this again hints at a certain level of widening the gap between the students with disabilities and students with who do not have a certain disability. And also, on the other hand, this second girl, Vanuja, she's from Kilinochchi. So she highlighted, she was a war victim. She has been made disabled during the war effort. So for her, therefore, she had found it easier for her to deal with other students because she doesn't have to reveal her body. So because in most cases, the experiences of disability are embodied. The body itself becomes a representation of disability. And the fact that she doesn't have to show her body or people would not see her body, she had found that as a way of encouraging her to liaise with others or to make herself known to others in different ways rather than her bodily experience. So, and now what I try to do by putting these two chords together is to show the mixed outcomes that we have had during the pandemic, and to highlight the necessity of rethinking the pandemic, not only through a very negative perspective, but it has its own positives, or rather its own benefits, which may be overlooked in our attempt or in our perception of pandemic as a negative outcome. So the next aspect that I would like to highlight is the unsystematic approach to online education. So most of the, actually almost all the participants and other students who are having certain disabilities with whom I have been interacting over the year or so, had highlighted that they had no prior introduction to the online platforms, and they had to, in most cases, figure this out by themselves. And during the meantime, they had missed a number of lectures, sometimes assignments, and what they highlighted was that it was hard to catch up once they have missed the introductory elements of the lectures. So now this shows in a way, an unsystematic way of approaching the pandemic, which have further marginalized the already marginalized learner groups, such as persons with disabilities. Because but one thing that I think have to understand is that disability is not occurring in a single line of identity. It is interwoven with multiple identities. So for example, the awareness, technical awareness or access to technology. These things work to create hierarchies that we had not seen previously. New hierarchies that are working to widen the social divide or the gap that we have seen in the society. And another interesting observation that I made during the interviews was that there's a certain perception of technology as a male domain. Technology as something that can only be handled by men. So a person that I would like to cite here is one student highlighted, Naini from the University of California, highlighted that she always relied on her brother to access internet or to get into the lectures or to download the materials, which in turn work to disable or create disability or disablement in the society, which in turn is another challenge that you can experience, that I have realized during the experience, during my interviews. So what is interesting here is the fact that disability is not, excuse me, sorry for the interruption. Disability is not occurring in a disability is not occurring in a single category. It is interwoven with these identity markers that we have in the society, the economic challenges, social challenges, gender perceptions, the perception of what a man can do and what a woman can do. The ideas that are already interwoven to our existence have made more prominence during the pandemic. And on the other hand, as I said before, and these two, I thought of including these two observations as well to highlight how it has worked differently for other people. For if you look at these two extracts taken from the interviews, it shows that they show that for some people it has worked in a different way too. For example, it has eliminated the need for mobility or to travel or to work. Go to lectures and physically attend, which in turn for a person who is on wheelchair and who requires the assistance of a caregiver may become a challenge. So again, this shows the need for individual narratives to be heard more in terms of COVID-19 and the ensuing chaos during the after maybe now and also in the future. And finally, very quickly, I'd like to highlight the unfamiliar pedagogical experiences, because now we are talking about students transitioning from secondary education to tertiary education. And in that regard, so certain students have found it is difficult for them to adapt to the new ways of learning, maybe like referring to reading materials, preparing notes by themselves, which at the end of the day had led to create certain, again, barriers in terms of integrating themselves to the learning environments. And also the distance between the lecturer and the student, which in turn has also been, because now we are talking about students with muted mics and switched off cameras. So the lecturer may not get the opportunity to see the student, and the student who may have certain perceptions of disability as a nuisance for others. So may not be very proactive in terms of switching on the video or switching on the mic and asking a question or getting a clarification. So now, these challenges direct us to rethink our pedagogical experiences, the way that we think about pedagogy, the way that we think about how we are to learn and how we are to engage with the students within this pandemic and maybe in its aftermath. And because disability, as Anderson points out, is the world's largest marginal group, or the multicultural group who are being marginalized, because it has people with maybe with color differences, racial differences, religious differences. We have a lot of individuals coming into being, and a lot of diversity in there. So with that, so it allows us to, or this pandemic allows us to renegotiate the discourse of disability, and in terms within that, the discourse of pedagogy. And in that regard, so specifically for learners who are coming from their secondary level education to the tertiary level education, some form of grooming, where they can be made more attuned to the environment at a university. And also the increased participation in terms of extracurricular and co-curricular activities, where they get to engage with other people, especially within this time of a pandemic, may work in favor. Because now the first year itself is crucial in terms of like their university life, and it may affect their perception of education and then the perception of the world of work and society at large. So that draws me to the end of the presentation, and thank you.
Thank you, Isuru. We now move to our third and final presentation of this first research session. We have K.A.T. Madhushani from the Department of Disability Studies, University of Carnegie. She will present her study titled Access to Education with for Children with Learning Disabilities, Inclusive Primary School Teachers' Efficacy in Classroom Instructions for children with learning disabilities. Madhushani, you should be able to share the screen.
Means it's awful, Miss.
We can't see the presentation.
It's awful.
Okay.
Can you all hear me?
Yes. If you could click the presentation mode. Yeah. Thank you.
Good afternoon to you all. I'm Tisara Madhushani from Department of Disability, Faculty of Medicine, University of Kelaniya. First of all, I would like to thanks for the Joint Conference Committee for giving me this valuable opportunity. And today I'm going to talk about...
Sorry, Madhushani, sorry to interrupt you. Could you speak a little louder?
Okay. First of all, I would like to thanks for the Joint Conference Committee for giving me this valuable opportunity. Today I am going to talk about my research study, and it's on inclusive primary school teachers' efficacy in adapting classroom instructions for children with learning disabilities. This study was done by me and my research supervisor, Ms. Vidurani Dantanarayana, who is a lecturer at Faculty of Medicine, University of Kelaniya. This is the content of my research presentation. Here I have provided a brief introduction about this study. Education plays an important role in human development, and it's a way of gaining new knowledge, skills, and values. As you all know, the quality of the country is dependent on the teachers, and it has been emphasized that the teachers should have their own teachers' efficacy and ability to effectively handle classroom strategies. The concept of the teacher efficacy has progressively gained attention and importance from researchers. So here I have mentioned one definition about the teacher efficacy. According to the researcher, teacher efficacy is a teacher's belief on his or her capabilities to achieve expected learning outcomes during teaching, even with students who have academic difficulties. And this study observed that effective participation of students with learning disabilities during academic significantly rely on teachers' efficacy in classroom instructions. This is confirmed by the previous research findings, and they have shown that teachers' efficacy or their perception on their own capabilities they have to bring desired outcomes are very important for children with learning disabilities to succeed in their education. This study investigated primary school teachers' efficacy in adapting classroom instructions, and also this study investigated the importance of assessing and monitoring teacher efficacy among teachers who teach for students with learning disabilities to ensure and achieve their academic needs and effective participation of these students with learning disabilities in inclusive education. These are the research objectives. First objective is to investigate inclusive primary school teachers' efficacy in adapting classroom instructions for children with learning disabilities in the Thanumalwila education zone. And the objective 2 is to determine the association between teacher efficacy in adapting classroom instructions for children with learning disabilities and their characteristics in inclusive primary school teachers in the Thanumalwila education zone. I carried out a quantitative study, and study design was cross-sectional descriptive study. Study setting was inclusive primary schools in the Tanamalville education zone. I did this study with primary school teachers who are currently working in inclusive classrooms in the Tanamalville education zone, who teach for children with learning disabilities. I selected 60 consented inclusive primary school teachers using purposive sampling method. Since the COVID-19 pandemic situation in the country, it was difficult to approach the teachers, and therefore I administered the questionnaire over the phone. After I collected the data, I analyzed the data using descriptive statistics and inferential statistics. In here, I have shown the study procedure under 4 phases. In phase 1, I developed the questionnaire to review the literature, and questionnaire consisted with 2 sections. Section 1 include the demographical details of the participants, such as gender, age, and education qualification. Section 2 is about teachers' efficacy in adapting classroom instructions. It consisted with 15 questions with a 5-point rating Likert scale, including nothing to a great deal. Then in phase 2, I did face validation with 2 senior speech and language therapists and 2 inclusive primary school teachers. And then I modified the questionnaire where the necessary based on their comments. And then I pre-tested the questionnaire with 5 primary school teachers who teach for children with learning disabilities in inclusive classroom. Finally, I administered the developed and validated questionnaire over the phone. These are the results of the study. According to this, majority of the participants were female and only 9 participants.
Madhushani, we can't hear you. Can others hear Madhushani?
Have teaching experience of less than 5 years, and as reported by majority of teachers, most often there are 3 students with learning disabilities in inclusive classroom. Furthermore, most of the teachers had not participated training in special education and no undergone a teacher training program related to learning disability. This table shows the teacher efficacy in adapting classroom instructions. As shown in here, majority of teachers have quite a big ability to adapt classroom instructions for children with learning disabilities. But only one teacher indicated that difficulty to use appropriate equipment in inclusive classroom. In here, I have divided teachers' total efficacy scores into 3 categories as low efficacy, moderate efficacy, and high efficacy. And as you all can see in here, the majority of the teachers have moderate efficacy to adapt classroom instructions. To answer the second objective, I compare the teachers' total efficacy scores with their demographical variables. And this is show only teachers' educational qualification are associated with teacher efficacy in adapting classrooms in inclusive classroom. And other factors are not influenced with the teacher's efficacy level. In this slide, I have stated out study conclusions and recommendations. When discussed about the findings, this slide clearly shows the main findings and conclusions of the study. According to that, there are 3 arrows. These 3 arrows shows the conclusion of present study, and points form in right hand shows the findings of the previous studies. You can see a clear comparison study with previous study. When talk about this, The study showed that majority of primary school teachers have moderate level of efficacy in adapting instructions for children with learning disabilities. And this study confirmed by previous findings, and it has been shown that general education teachers have moderate level of teacher efficacy in adapting classroom instructions for children with learning disabilities. But some researchers have found that teachers have no any sufficient ability or have very low ability in adapting classroom instructions for children with learning disabilities. This study also showed that teachers' social demographical factors could be influenced by teachers' efficacy level, especially teachers' educational level associated with teachers' efficacy in adapting classroom instructions. The study was done by Bataini et al. In 2010, also confirmed this finding and stated that teachers' background variables are associated with teachers' efficacy scores, but some researchers have found that teachers' age, gender, years of experience in special education is not associated with their competency level. According to the current study, majority of teachers had not attended to training in special education and or teacher training program related to learning disabilities. But previous studies showed that showed a correlation between teacher efficacy and their years of teaching experience. Even though the study shows the association, some previous studies showed that their educational training are not influencing teachers' efficacy level. Based on the results of the study, current study provide valuable information on inclusive primary school teachers' efficacy in adapting classroom instructions for children with learning disabilities. And the study conclude that to achieve learning needs of the children, teachers need to adapt their instructions accordingly. And it is not adequate to have teachers' efficacy level within a moderate level, and they have shown the to meet the needs of individuals' learning needs, it has to be at least a comparatively adequate level. Therefore, this study shows it is crucial to arranging teacher training program, since it is reasonable to assume that a student with learning disabilities can be benefited from increased level efficacy of teachers to make equity, diversity, and inclusion when teaching in inclusive classroom instructions. And also previous research study shows the needs of arranging training program, and it's helped to identify how to adapt classroom instructions, and it also associate with teachers' efficacy level. And some researchers have shown that countries are shown the needs of arranging teacher training program through introducing the educational policies to train teachers to use adaptive classroom instructional strategies in inclusive classroom settings. These are the references that I used. Thank you all.
Thank you, Madhushani. A really lovely set of presentations on the issues that educational spaces, context, institutions face, especially at this time, but in general also with students with disabilities. We have about 15 minutes for questions. Because the presenters beautifully stayed on time. So please let me know if you have questions. I already have one which I can ask, but I do encourage you to ask other questions. So until we have other questions, let me ask the first question I received. This was initially asked from I think, let me see who it was asked from. I think Isuru, but I guess it will work for anyone. It is what could teachers do to facilitate access during the class? What could the teachers do to facilitate access?
May I ask, Doctor, answer the question?
Sure.
Yeah, sure. Thank you. So thank you for that interesting question. So now, facilitating access within the classroom, I think one of the first things that we have to really think about is what really is the access that the person may require. Is it the access to access the lectures or to listen to the lecture, or maybe it might be different from that, maybe access in terms of motivating the learner to ask a question or to engage in the lecture. So therefore, I think there's a certain importance for us to understand the specific requirements and of the learner that we are dealing with. Because if you look at people or persons with disabilities or students with disabilities, maybe at the school level or also at the university level as well, they are a diverse group of individuals, which in turn is a rewarding thing as well as a challenge. So therefore, I think there's a great necessity for us to understand what the individual actually requires. I think that is a starting point. And building from that, and the teachers may have or may require to maybe like engage them in the classroom discussions if the learner is generally docile or not willing to talk. So how then the teacher may have to rethink the way the lecture is or the lesson is conducted to get that learner also participated in the lecture. Because now, as we know, the diversity, the whole concept of diversity and inclusion is to like facilitate learning from one another. It's not learning only from the teachers. The students are not only learning from the teachers. We have teachers, students and student teachers. So to facilitate that and to see the person with the disability as an enriching experience to the others. That is how I think we understand people with disabilities within an inclusive classroom. We see them as an interesting addition to the others. So in that regard, I think the next biggest difficulty or the challenge might be to get them involved in the discussion and to help them move along with the others in terms of like moving forward. I think I answered.
Yes, thank you, Isuru. Can I also invite Chandima to answer that question too? And Chandima, there is a second question from you. I think you can probably answer both together. The first one was, what steps can teachers take? The second is by Domini De Silva. She says, it was a good presentation. According to your perception, what steps that the universities can take immediately to support the students with visual impairment based on your study findings?
Okay, thank you so much. And based on our findings, actually most of the students, they said about the sensitive coordinators for disabilities, student with disability. And also they discuss about that training for trainers. It means coordinators or academic staff for that friendly relationship. And also that I basically concern about the student, because I think Fiona also discussed about the cooperation and student individual approach should be developed. And when it comes to we can do kind of soft skill for especially these student visually impaired student, because they sometimes still they are depend on the friend circle. They are totally student fully blind blind students, they said about that they missing their pen circles and those things. And I think that technology skills also we have to concern, and also we have to concern about their soft skills when it comes to because I share one experience about the extraordinary student, because he used his own method to cooperate with the student staff, and also using his soft skills and technological skills. And sorry, can I ask another question? I think I have another question.
What?
Sorry, I didn't get, there is 2 questions, no?
Yes, one was what steps can the universities take to immediately support students with visual impairments?
And also that we have to concern about the partially blind student, because they are complain about their health conditions, and sometimes they feel like whole day. Then today when they attend lecture, sometimes they may not attend tomorrow lecture because of the headaches and psychological issues. And when I could chance to interview 7 students, and that among female students, they said about when we discuss with them. And I think that counselors and that psychological support should be there, because they need that assistance. At least if we can talk those students, it is also help to them.
Thank you, Chandima. Insightful. I hope all the teachers are taking note. Vani Surendranathan has raised her hand. You can ask the question.
Oh, thank you. I mean, I found very interesting the presenters. Actually, congratulations. My question is actually, Chandima or lightly touched on that subject. It's about the mental health. I mean, there were interesting these things. Some said they are comfortable learning online because they don't have to, their disability is not visible to others. Therefore, they are very comfortable about it. They like the online education. Some mention that they lack peer support. So therefore, they are finding very difficult with the online education. I just wanted to ask, especially somebody who's transitioning from secondary education into tertiary education, does the universities take into account of providing counseling services, the transition that they are coming from? They were treated as children, now they are treated, very much as an adult. What kind of measures are taken for their mental health? Some I felt maybe they could be bullied. So they feel very comfortable studying online, because this is something that I learned from the children in the schools, because some felt very comfortable about studying online because they felt that they are not bullied anymore in the school. So I just wanted to know what kind of measures that the universities takes, especially for mental health aspects when the children are coming from secondary to tertiary education.
Hi, I think that question is for me.
Yes, yes.
Yeah, thank you. Yeah, so now, yeah, it's a good question, because now at universities, almost all the universities have mental assistance services in place. And I think it's not an institutional wise issue that you encounter, but I think it's a perception of people about mental health issues, and and how we choose to look at mental health issues is the barrier that we may encounter in terms of encouraging people to seek medical assistance, or the mental assistance, right? So I think that is a possible area of like study or like research, some maybe where like how and why people may not seek mental assistance, and how we can encourage them in terms of, I think there's a lot of research has gone into this area as well. How we can encourage them to seek mental assistance in that regard. I think, yeah, so that's an important area, and I think it's more to do with the questions of how and why people are not seeking mental assistance, and how they can be motivated, rather than like not having institutional accommodations in place. Yeah, thank you.
Does anyone else want to answer that question, or does anyone else have any other questions? We have about 3 minutes more. Can I then ask, since there aren't any other questions from all three of you, what are any last recommendations for ways forward?
And I think individual attention should be given, because when it comes to I think this answer linked with the previous question, that our student, we did kind of comparison, what is the feeling about the online education first year student, and they don't have experience about the physical education early, and that when it comes to the fully blind, different aspect, and also the partial impaired student also, they have different idea about the online education, because this prevailing situation is okay, but anyhow they prefer, most of them they prefer physical previous education system. And I think that individual, because that I, according to the my our understanding, our team understanding, this is the very inclusive method when it comes to the student with the visually impaired. If we can improve their technology, soft skills, and it is, I think, very good. And we have to give attention to the individual.
Thank you, Chandima. Isru and Madhushani.
Yeah, thanks, Doctor. So as a last remark, yeah, I didn't, this, apart from what Ms. Vanuja, right, I highlighted, I think one important area to consider might be more systematizing our approach to education, and like rethinking how we are like approaching a classroom, even like a single lecture. So how are we to like think about it in a very different angle, which then will lead to like inclusion of almost all the students, not only with disabilities, but also with other learning requirements. So I think in that regard, systematizing and our approach to pedagogy might be important, especially within these times, which are like very chaotic and demanding. So I think that might be interesting area to think about or concern. Thank you.
Yes. I think the teacher efficacy is the most important, because the teachers should know their ability to and capabilities to achieve the students' needs in the individual in the classroom, and they also need to know the what are the adaptive instructions, and how adapt the instructions according to the individual child, especially who is some needs for the learning. Um, Therefore, I think there is a need of organizing the teacher training programs, and in their need to consider the teacher efficacy and incorporate these concepts to teacher training programs. I think that it's...
Thank you. Oops. Thank you to all three speakers and for that interesting discussion. We enjoyed a really informative set of presentations on access to education in both university and primary school level. Unfortunately, we don't have a lot more time to stay there in this space and talk about these things further, but we now move to research session 2. I want to remind everyone that there is Sinhala and Tamil interpretation happening also. If you click that interpretation, the globe icon at the bottom. Thank you, and please wait for research session 2.